From nurse practitioner to independent practice to the co-founder of the Institute for Pelvic Health, this is Kathy Cates' entrepreneurial journey. This episode is part of our series on nurses who took the leap to leave their traditional nursing position and go full-time on their entrepreneurial journey during the COVID-19 pandemic. One of the biggest decisions you have to make in your journey from side hustle to full-time entrepreneur is when to make the leap. In quote-unquote normal times, this is a hard decision, but the uncertainty of the pandemic has brought a new set of challenges. And yet, a large number of nurses have decided to do just that, leave the security of their traditional nursing job and go full-time with their business. And the results have been tremendously positive. I want to share with you their inspiring stories. Today, we're talking with Kathy Cates. Kathy is a family nurse practitioner and pelvic floor therapist. Kathy's first-hand knowledge about pelvic health comes from her experience being a mom and as a former cancer patient. Her work is enhanced by over 10 years as a nurse practitioner, running a women's health program at a federally qualified health center. Kathy works with Melissa Hines, a pelvic floor physical therapist. They utilize an interdisciplinary holistic approach to pelvic health in both the clinic and mentorship. This unique approach works so beautifully that Kathy and Melissa were inspired to create the Institute for Pelvic Health. The Institute for Pelvic Health empowers nurse practitioners by providing real pelvic floor education for real clinical situations with free weekly YouTube videos. An online course with CEU credit available will be available in July of 2021. Listen in as Kathy tells us her story of going from burned out NP to grant recipient to co-founder of the Institute for Pelvic Health.
Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle. Whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started.
Hello and welcome to this week's episode of the Stay at Home Nurse Podcast. Today we have another special guest with us, Kathy Cates. So Kathy is a nurse practitioner turned entrepreneur who is now a full-time entrepreneur, and she's part of our series on nurses that have taken the leap into entrepreneurship full-time. So Kathy, tell us a little bit about yourself, your background.
Sure. Thank you for having me. So I'm a family nurse practitioner, and I have been for the past 11 years. Prior to that, I was a classical musician, and I played with the Boston Pops. So that's sort of an interesting, fun fact about me. And so for 10 years, I worked at a federally qualified health center, basically full-time, caring for families. In an underserved, mainly Spanish-speaking community here in Boston. And about, 5 years ago, 2016, there was an opportunity for a grant for primary care provider retention to give you money and time to develop an interest. And so I was very interested in the pelvic floor. And so I wrote a grant that called Bringing Awareness of the Pelvic Floor into Primary Care, and was awarded the grant, so got the protected time and funds to be able to get training. And then I started a pelvic floor therapy clinic at my federally qualified health center because our patients, it was very challenging for them to have access to that type of a service. And that was in 2016. And I don't know, the word kind of got out that I was doing this kind of work. And so from there, about a year later, I opened my own private practice, very much on the side, cut down a little bit at the health center, And that went along for a little while. And then it became more and more. My private practice was growing. So I cut down at the health center more. And then during COVID, I actually learned that you can do a lot of things virtually for pelvic floor therapy, which I know seems strange, but actually it works sometimes very, very well. And then during COVID, I decided to really cut back from the community health center and now work on a per diem role there. So I just go in twice a month at a time that suits me to go in and provide pelvic floor therapy there, and also a number of GYN procedures, colposcopies, IUD insertions, and things like that.
That's a very interesting story.
Yeah.
First question, and I know everybody's probably wondering this, is what instrument did you play?
Oh, yeah. The oboe and the English horn.
Okay, so got that out of the way.
Yeah.
The next question is, so you said that you worked in a lot of Spanish speaking. Do you speak Spanish? Are you bilingual?
I do.
So that's very helpful.
Super helpful.
Yes. Okay.
Super helpful.
So I think a lot of people wonder, like, how do you get a grant? How did you even find out that this grant was out there?
Right. Great question. So the health center where I worked was part of the Massachusetts League of Community Health Centers, and there are about 25, I think, throughout the state. And the grant was through them. So they would request for proposal, RFP. And, when I was first starting out, it just seemed too much. I was like, I just need to figure out how to be a family nurse practitioner. This is so overwhelming. And then, it became manageably overwhelming. And so I was like, okay, this is a great chance to try and explore this interest that I have.
Okay, next question. Is the grant something that you're still getting money for, or was it like a one-time thing just to get the information that you needed?
So it was a year-long opportunity.
So during that year with that grant, you were able to do the research that you needed and spend the time studying this. Is that correct?
Correct.
And then you used this information in your practice. Correct. And then transitioned it into your own practice? Am I following this? Okay.
You got it. You got it. Yeah.
Okay. Yeah. I'm really liking that. So basically the grant gave you the freedom to kind of take some time to really look into this and get your, kind of get your feet wet in it and decide if it was, really research. It's something that you don't have time to do when you're working full time with a practice.
Oh, no, not at all. And I would have thought, if you asked me when I became a nurse practitioner, if I would be in business for myself, I never would have thought, ever.
So let's talk about that. What inspired you to go from working for this organization to working for yourself? How did that happen?
First of all, I was very fortunate that I had the patients, right? Like I had a lot of people that wanted this type of service, that wanted pelvic floor therapy. And then I was also lucky enough to find a great physical therapist partner. So I started off on my own, and then we sort of merged together as practitioners. And now we'll get to this at a later point, but we've also now created the Institute for Pelvic Health, which is our newest venture, which I'm super excited about. So to demystify the pelvic floor for nurse practitioners through an online course and like online education, because I really, I guess I'm getting ahead of myself, but I saw such a gap in my own knowledge. Like I didn't know what the pelvic floor was, and I ran a women's health department for 4 years, and I didn't know what the pelvic floor was. And it wasn't until I had my own pelvic floor issues that I was like, oh my God, how many people have I treated and never thought about the pelvic floor? So, yeah.
I find it very interesting because I think a lot of entrepreneurs, from what I'm saying is it was a need that they had. It was something that, either them or a family member or a friend or something that they felt was needed, that they needed, and they see this unmet need, and then they decide that they need to fill the need.
Totally. As a patient myself, when I was having issues and I called, I couldn't get in to see my gynecologist for like 6 months. And I was like, well, wait a minute. And that just seemed like such an huge amount of time to wait. And then luckily my nurse practitioner knew enough about the pelvic floor that she said, you need pelvic floor therapy. I'm like, what's that? And then I thought, oh my God, how did I not know? I never learned.
Right, right.
Yeah.
So, and I can definitely understand that because it's not something we don't learn everything, unfortunately. It's kind of one of those things where you get exactly enough to get you through and you get the basics.
Right.
And then once we're out there practicing is when we learn everything else. And we don't
Right.
learn everything else. We learn, there's a lot of gaps. And I'm so happy that I have interviewed so many nurses and nurse practitioners that are trying to fill these gaps and
Yeah.
creating their courses and creating their programs to help others to not have to struggle kind of like they did to find out this information, but to make it easier. It's something that is very inspiring to me because our job is hard enough. And if we can make it easier for somebody else because we figured something out, let's do it. Let's all share it. Yeah. Yeah. Because in the end, it helps our patients, right?
Totally. And it helps nurse practitioners and nurses because you're not as burned out because you don't see, you know, the same person on your schedule again with pelvic pain. And you're like, I don't know what to do.
Yes.
Let me order another pelvic ultrasound, even though she's already had 5. Let me treat her for a vaginal infection that she doesn't have. Like, let me treat her for a urinary tract infection that she doesn't have. Right. And so it's just so powerful. And even like, I remember when I was doing the literature review to write my grant, that was one of the big things was like, the providers don't understand it. Patients are so desperate, and that's a very bad combination. And everybody leaves that interaction feeling so helpless.
So tell me a little bit more about the journey. You kind of brushed over how you started working less and less in your practice and more in the pelvic floor. So tell me a little bit more about that. Let the listeners know how exactly that happened.
Totally. So like I said, it started, literally like I was in the car on the phone getting my malpractice insurance and saying, when is this good? When does this start? And they're like, oh, right now. I'm like, great. And I literally like 5 minutes later went to see my first patient. I don't recommend that.
I love that. Let's talk about, you didn't
know.
give yourself a chance to like change your mind, right?
Yeah, it was like, okay, here we go. And then I loved it. I loved that I had more time with people. I was used to seeing 22 patients a day, every 15, 20 minutes. And now I could see 4 people in a morning or 4 people in an afternoon and get paid more money and just have that luxury of time, and I think as nurses and nurse practitioners, we probably went into it for the health promotion. And I felt like, wow, with more time, you can really do a lot of that. And that was super exciting to me. And then the need became greater and I was filling more of my hours. And then it was like, wow, I can do the private practice, which is so fulfilling, so much less stressful. And, I was doing primary care. And I was burned out. The systems, we all know, like they're not set up to support longevity. I think I was the longest one at my health center before I left my full-time position there.
And how long were you there?
10 years.
Okay. Yeah. Which is really sad because unfortunately when we or our family members or loved ones need somebody, we're not getting the experienced people because they're burning out. So You're getting the people right out of school that are still trying to figure it out until they get burned out and then they move on to something else. And it's a broken system. But we all know the system's broke. Let's talk about what you're doing to fix it. So I have a couple more questions for you. So when you started seeing patients away from your, we're just going to call it your work, just to distinguish. Did you start seeing them online, or did you open your own brick and mortar? Did you have your own office?
So I had my own office. I was renting a room in a wellness center.
Okay.
So this was pre-COVID.
And how did you find?
So telehealth wasn't quite what it is now.
How did you find these clients? Like, how did you find people that were willing to pay you to come and see you in this center?
Right. So through my network that I had built of midwives, gynecologists, urogynecologists, through my work at the health center, and basically, if people, I think they would send people my way that they knew could afford to pay out of pocket, and I think also enough could submit my receipts and get reimbursement, and at least partially reimbursed for the visit.
So like if they had a high deductible health plan or something and they can get a receipt and then get reimbursed for it. Okay.
Exactly.
Okay.
Yeah. So I would provide super bills like right away with all the things that, the MPI number, the EIN number, the EC, the E&M coding and all of that, that if you had out of network coverage, you could try
Okay. So
that.
did you,
But I was just myself, so I couldn't really take on
that was my next
insurance.
question. So did you personally bill insurance yourself, or you just pretty much said, if you're private pay, come to me, or if I can give you a receipt and you
Yeah,
can file it yourself if you have like a high deductible plan or something like that. Okay.
exactly.
Okay.
Exactly. Yeah.
So I'm
Yeah.
assuming that I'm thinking if I'm a practitioner or a midwife or somebody and I have somebody with this, and like you said, they've been coming time after time and I don't know how to fix them, I'm relieved to say, oh, I'm going to refer you to Kathy, because now I'm doing
Totally.
something, and I'm doing something that I know is going to help you, but I don't have to
Right.
personally fix it myself. So I'm assuming you got a lot of
Exactly.
business that way. Okay.
A lot of business. Yeah.
So things are going well. You have this business, you have this private practice, and then COVID happens. Or wait, what happened next? Did
Yeah.
you got a partner first, or COVID
So
happened? I don't want to rush this.
So, partner first. So, there was a lovely physical therapist. Her name is Melissa Hines, and she's amazing. And we had been introduced. It's a small world of people that do pelvic floor therapy, as you might imagine, and even smaller if you're a nurse practitioner, because most people that do the work are physical therapists. Even though nurse practitioners are perfect to do this kind of work because nurse practitioners are so familiar with the bimanual exam, right? So you're starting from such a different point than a physical therapist who has no training in a bimanual exam, which I find fascinating, but that's for another time. And so Melissa was, super helpful just in terms of when I was first starting out about like providing the super bills and doing things like that. And then we just happened to be chatting in the fall of 2019, and she's like, I need to hire somebody else. I haven't found somebody that's the right fit. My practice is expanding. What do you think? You want to like come and try it out for a couple months? You could bring your patients with you. And we never looked back.
Wow. So she already had a practice, and she had her own facility, I'm assuming, or a room that she was using,
Yeah. So
or
she rented, yeah. So she had one tiny little room. And then within by like the summer, I think that was 2019. And then the summer, I'm not remembering quite the right dates, but maybe within 6 or 7 months, then we relocated to a bigger space to accommodate more patients.
okay.
And so that we could both be in the office at the same time.
Okay. And this is in one geographical location because obviously you're seeing patients that are in your geographical location. But
Right.
it's interesting to find that it was such a small niche you were able to support a practice for two professionals now. So there's a
Oh,
lot of people that
yeah.
have this problem. This is telling me there's a
Huge.
lot of people that are having this
It
problem.
is such an underserved need. And we see men too. So people think of the pelvic floor as a female issue. And then if you can find a pelvic floor therapist, not all of them see men, and we see men as
Okay.
well.
But
So,
men have a pelvis, even though it doesn't give birth through it, they still have a pelvis. So
and
I
they
guess that,
still have hypertonic pelvic floor muscles that cause a whole host of, urinary, bowel, sexual dysfunction, just like women.
okay.
So,
So this is very good to know. And I'm liking how you're explaining your journey, because it doesn't sound like it took real long though from the time that you
no, I know I can't. My husband and I always are like, how did this happen? Like, wow, it just kind of, yeah,
yeah, I have
yeah,
really found through these interviews that I'm doing how quickly um, when everything kind of comes in the right place and you have the
yeah,
groundwork and the framework, it looks like things happen really quickly. But you applied for the grant, You put your time
Yeah.
in, you saw a need. There was a lot of prep work, kind of
Yes.
like getting the soil prepared. And then all of a sudden,
Totally.
something just kind of beautiful blooms from that once you do all the work and getting everything ready for it.
And part of tending to that soil are the connections that you make with people and people
Yeah,
knowing and trusting you.
absolutely. And that takes time. And I don't think we realize that, that's one of the things I'm very big on is networking and connections and never burning bridges and getting, you never know who that next connection is going to be. And even they don't know someone, you think of that, what is it, 6 degrees of separation?
Right.
People know people who know people who know people. And that might be the
Right.
person who, and not to go off on another tangent, but the other thing is letting people know what you do. So many people are afraid to say that I'm doing this on the side or I have
Right.
this other passion. But no, when you let people know and then they know somebody else who can help you and they can make that connection, but if you kind of hide it.
So can I, to your point, this is so
Please,
interesting.
yes.
A colleague of mine at the health center at my work was interviewing for another job. And she said, can you give me a recommendation? I said, of course, she's amazing. I'm like, I'd be delighted. So I wrote her a glowing recommendation. And the medical director, the next time she went to interview, she's like, oh, I Googled that Kathy Cates. Does she do pelvic floor? I was like, yeah, she does. Long story short, like she ended up becoming a patient,
Oh, wow.
right? Like
So you never
like
know.
crazy. So you never know, right? Like bizarre. And when she came in, the medical director person, she was like, yeah, I've been hearing about you in my yoga class for years. And then like and then your name finally came across my desk and I was like, I have to go and see her. So, I mean, you just never know.
Oh, that's a crazy story. I'm so glad you
I
brought that.
know.
Yeah, I love
Yeah.
that. Okay, so I think we're at the point now where you have a partner. And so this is a true partnership. So you guys did like a partnership agreement and everything, like you made it a true partnership?
So for the excellent question, for the clinical, like brick and mortar part, and even the telehealth visit, the uh, video visits and things, I work as an independent contractor for her.
Okay.
Our formal partnership, like where we formed an LLC, came back in just a few months ago in February when we launched the Institute for Pelvic Health.
Okay. Okay. So I'm getting excited now. Um, and the reason I am is because so many people, like, this is something that's the big gray area. Like, we know how to do nursing, we know how to do, whatever we're good at. But when it comes time to forming partnerships and employees and all that, this is where sometimes it can get messy. So I kind of want to just pause here and sit on this for a minute. So just to clarify for people, a 1099 means that you don't actually have to have them as an employee. So she brought you on as a 1099, meaning you were an independent contractor and you did not become her employee and she did not become
No,
your employer. And this
correct.
is a nice way to grow your business and to bring on extra help without taking on the burden of having an employee. It's actually something that we do in our business also. There are, not just to put it out there are some very clear government IRS guidelines about what makes somebody a 1099 versus what makes them an employee. So that's something that you have to look into. But this is a wonderful option for somebody who's looking to start a business. They know they're going to need help and they're afraid of the whole employee thing. The other thing is the partnership. So that's different. That's different. That means you two are joining forces, kind of like a marriage. And there's a lot to consider when you're partnering with somebody. So the fact that you guys have worked together beforehand, knew how you work together, I think that would probably make it much easier for you to decide to go into partnership together. So do you have anything you want to add to anything I've said there, or do we want to start talking about the partnership now and the Institute for Pelvic Health?
I think you covered it all.
Okay, so tell us, how did you decide to start the Institute for Pelvic Health? I want to hear about that.
Yeah. So I think because of COVID, and we realized that, and also my partner just had a baby. Her daughter will be 1 in June.
Oh,
And
sweet.
yeah, amazing. Her name is, well, she's going to be our CEO, my partner's daughter. She's
Oh,
the
I love that.
CEO,
I love that.
Louisa. She's the CEO of the Institute for Pelvic Health. And I think we both decided we didn't want to work Like the one-on-one model, while it's great and lucrative, we want something different for our future. I have a 14-year-old, and so we want something different for our daughters. We don't want to have to be in the office to be generating revenue.
So you want to go from trading dollars for hours to setting up a business that is not trading dollars for hours, because you went from being an employee for someone else to being an employee for your patients, to where the only way you could make money is if you were seeing a patient.
Correct.
Yes. And I think this is a very important point too for our listeners, because when we're looking at different types of businesses or side hustles or things that we're doing, I love the stepping stone that you're taking from, okay, working for someone else to working for ourselves to, okay, how do we now move from, it's not freelancing, but it's kind of like freelancing in that you're freelancing with all these different patients. You have all these different clients that you have to get. So I'm interested in how you're going from that model to a more business model that's not quite trading time for dollars. Tell me more about that.
Right. So, we brainstormed a lot of different things about ways to not have it be you have to be seeing a patient to generate revenue. And also the fact that between the two of us, we have a ton of experience and that we have this unique interdisciplinary relationship. And Melissa would keep saying to me, do nurse practitioners really not know this? Like, how do you know this? Like, how come they don't know that? Like, they really don't know. I'm like, Melissa, they really don't know. She's like, how is it possible? So that was the huge gap that we saw. And we were like, this is where we can really have such a larger impact on the whole field of pelvic health. We love the one-on-one, and having that impact is so important. And I think she and I will always do some of that. We just both want to do less of it.
So what exactly is, and please, am I saying it right? The Institute for Pelvic Health? Am I saying it? Okay.
You got it right. Yeah.
Okay. I want to make sure I didn't make that up. So what exactly will you be providing, and who are you providing it for?
It's a great question. So we spent time, and I think for anybody starting a business, you have to spend time with that ICA, right? With who is your ideal client avatar. And so ours is women's health to start. Like, we really niched it down. It's like women's health nurse practitioners, midwives, family nurse practitioners that treat women with pelvic pain. And so it's like, how do we help you by demystifying the pelvic floor to provide hope and help to your patients? We're starting, again, niching it down even more to your cis female patients with pelvic pain. And we do that. So we literally just started 2 months ago. So we're in the building the trust, stage of the game. And so we do every week we release a different YouTube video. So we have free weekly YouTube videos covering a different pelvic health topic where the two of us are having a conversation. So interdisciplinary. We have a weekly newsletter. We have platforms across all social media where you can ask us a pelvic health question. So that's how we get what the next topic is going to be that we talk about. And this is all in preparation for the launch of our course. We haven't quite come up with a title yet. We're thinking Beyond the Kegel, integrating the pelvic floor into your clinical practice, but we're not quite sure. And that's going to launch the end of September. And that is an online course for nurse practitioners. We're going to get it accredited by AANP so you can get CEU credits for it. And it's really looking at the 5 most common pelvic pain diagnoses that we see. And it's pretty cool. It's set up as a SOAP note, right? So it's like you've got your intro to the anatomy and physiology, which maybe you learned in school, but you were so overwhelmed you couldn't pay attention. And then the subjective and how the questions you ask can help you to start putting the pieces together that there might be a pelvic floor etiology right? And then the objective, things to look for externally, internally, we go in depth to covering how to assess for pelvic floor motor control, which means like, do the muscles contract and release? And then pelvic floor tone, are they tight? And then we have the assessment and plan part of your SOAP note is how to put the pieces together and how to help your patient. So
I'm loving this. I'm getting so excited as I'm hearing this,
I'm
because I
so
think,
glad.
yeah, I'm thinking of all the different things. Like, you definitely need a place to start, but this can go so much beyond there. And yes, I can definitely see this.
Totally.
Yes. And I love that you have found that bullseye of where you want to start, of like, this is what we're going to do to start. We have our focus, we have our area, but knowing that you have so much more around all of that, that once you get that framework and that foundation built, that you can really, yes.
Right.
So,
and like, we get questions all the time. I didn't mean to interrupt you,
No,
about,
please.
People are like, do you guys do mentorship? Like, can I come and do like an intensive week at your clinic? Like, what about men? Like, what about male pelvic pain? Like, and the list goes on. And we're like, we're keeping a running list. But to your point, we have to be razor focused on the beginning stages of this, because if we're razor focused, it's going to be amazing, and we're going to deliver a very high quality course that we would have wanted to take. And then we're going to build from there. And we are going to revolutionize the way that nurse practitioners do their pelvic exams.
Absolutely. And it's going to, the way that you're doing this, you're going to be able to impact so many more patients than you could have ever impacted just by seeing patients, that one patient at a time. Yes. And that's what I like. I love when we can say, okay, this worked. What we're doing worked. We know what we're doing. We know how to do it. Now, how do we teach other people what we know? And you do it one step at a time, and you take it one step at a time, and you get there. So I'm so excited about this for you guys. I love seeing entrepreneurs, and I love seeing nurse entrepreneurs. I feel like nurses make awesome entrepreneurs because, for one thing, we really know the why behind it. The why is because we can impact so many more patients, so many more people, so many more lives by taking it. When we find something that works really well, beyond us just doing it for that one patient, to us helping our colleagues to be able to take this information that we have and help them, so that out they're helping all these patients. So it just it makes it so much bigger. I'm loving it. And you're making that nurse practitioner's job easier, so everybody wins. I call it the win-win-win. I like to see that the patient's winning, you're winning, and the nurse practitioner's winning. So everybody is winning, and that's wonderful. What have we not talked about? I think you have a podcast. Is that right?
We don't have a podcast.
Okay,
we have a YouTube channel.
The YouTube
but we
channel.
Don't have a podcast. Yeah.
Okay. So to clarify that, you have the YouTube channel, and how can people find your YouTube channel?
So instituteforpelvichealth.com.
Awesome. Okay. Is there anything else that we didn't cover that I missed that we should be diving into?
No, I think we covered it all. So exciting.
Yeah, I'm very excited. I'm very excited about this. And yes, I want to thank you for inspiring the listeners. Of course. Just to hear your story about how just a few years ago, where you were just getting a grant because you were getting burned out, and now you've turned it into this business. And I can tell, I wish, the one bad thing about podcasts is you can't see just how relaxed you are. And the listeners don't know that right before we got on here, like I just spent the last hour and 10 minutes trying to get all my technology to work. And as soon as I got one thing fixed, it was just whack-a-mole. The next thing was not working, and the next thing. And, you were able to just kind of get on and calm me down and get me nice and relaxed. I just want to tell you, Kathy knows her stuff, and she really does. And I'm really glad that we were able to get this important message out. This ended up being an excellent interview, and I know it's going to inspire so many people.
Thank you so much for having me on. I so appreciate it.
You are so
welcome. Nurses can do anything.
Yes,
Nurses can do anything.
Okay, thank you very much.
You're so welcome.
I love Kathy's entrepreneurial journey. I love how she went from burned out nurse practitioner to grant recipient to independent practice, and then realized after reaching success with her independent practice that she still wanted something more. She wanted to stop trading her hours for dollars and become an entrepreneur who got paid for the value she provided. If you're interested in starting your entrepreneurial journey, I'd like to invite you to attend one of our webinars. Janine Kelbach and I do webinars on lifestyle entrepreneurship. If this is something you'd like to look into, I invite you to go to the website unconventionalprofessionals.com. There, you can sign up for our next webinar or sign up to be notified when we host another one. Again, that's unconventionalprofessionals.com. That's a wrap for this week's episode. I look forward to seeing you next week. Make sure you subscribe so you never miss an episode. Adios from beautiful Puerto Aventuras, Mexico.